Today's update is important, and I want to start by speaking to you directly, clearly, and calmly because there has been a lot of confusion, a lot of noise, and a lot of worry surrounding recent Medicare payment changes connected to former President Donald Trump's policy direction. Many seniors have been hearing headlines about Medicare payments, benefit adjustments, cost changes, and possible impacts on monthly budgets, and it is completely understandable to feel concerned. This video is here to explain what is actually happening, what has already changed, what is being discussed, and what older Americans should realistically expect going forward, using clear language without political drama or complicated financial terms. Medicare is one of the most important programs for seniors in the United States. It affects doctor visits, hospital stays, prescription drugs, preventive care, and long-term health planning. Any change to how Medicare is paid for or how providers are reimbursed can eventually affect access to care, out-of-pocket costs, and the stability seniors rely on. When news breaks about a Medicare payment change tied to a major political figure like Donald Trump, it naturally raises concerns about whether benefits are being cut, shifted, delayed, or reshaped in ways that could hurt older adults. To understand what is happening now, it is important to understand how Medicare payments work at a basic level. Medicare does not send most seniors a monthly check like Social Security does. Instead, Medicare pays doctors, hospitals, pharmacies, and healthcare providers for services seniors receive. Changes to Medicare payments usually mean changes to how much providers are paid, how services are priced, or how costs are shared between the government and patients. Even though seniors do not receive Medicare money directly, these payment changes still affect seniors in very real ways. During Donald Trump's presidency and continuing into the current political discussion, several Medicare payment policies were introduced or expanded with the stated goal of reducing government spending, increasing efficiency, and shifting how healthcare services are delivered. One of the biggest focuses was on changing how Medicare pays providers, especially through value-based payment models. These models aim to reward doctors and hospitals for outcomes rather than the number of services provided. While this sounds positive on the surface, it also creates uncertainty for providers, which can indirectly affect seniors. One major Medicare payment change that originated during the Trump administration involved lowering certain reimbursement rates for hospitals and outpatient services. The goal was to reduce overall Medicare spending and slow the growth of healthcare costs. However, when reimbursement rates are lowered, some providers respond by limiting the number of Medicare patients they accept, reducing services, or increasing costs in other areas. Seniors often feel these changes through longer wait times, fewer provider choices, or higher supplemental costs. Another significant area of change involved Medicare Advantage plans. These are private plans that replace original Medicare for many seniors. During the Trump years, Medicare Advantage plans were expanded and promoted heavily. Payments to these private insurers increased and enrollment grew rapidly. Supporters argued this gave seniors more choices and extra benefits like vision and dental coverage. Critics argued that higher payments to private insurers increased overall Medicare costs and created confusion for seniors trying to compare plans. Medicare payment policies under Trump also included efforts to lower prescription drug prices by changing how Medicare pays for certain medications. Some of these proposals focused on tying U.S. drug prices to prices paid in other countries. While the intention was to reduce costs for seniors, many of these changes faced legal challenges, delays, or partial implementation. As a result, the impact on seniors has been uneven and difficult to predict. It is important to understand that not all Medicare payment changes happen immediately. Many are phased in slowly over several years. This means seniors may not feel the effects right away, but gradual changes can add up over time. For example, a small increase in co-payments or a change in coverage rules may seem manageable at first, but over the course of a year, it can significantly affect a fixed income budget. Medicare payment changes are also closely connected to broader discussions about federal spending, deficits, and entitlement programs. When political leaders talk about cutting costs or restructuring programs, Medicare is often part of that conversation. This does not automatically mean benefits are being eliminated, but it does mean that payment structures can change in ways that affect how care is delivered. Many seniors worry that Medicare payment changes will reduce the quality of care they receive. This fear is not unreasonable. When providers receive lower payments, they may have fewer resources to spend on staff, equipment, or patient support. In rural areas where hospitals already operate on thin margins, payment changes can be especially challenging. Seniors in these areas may experience reduced access to care or longer travel times for medical services. Another concern involves out-of-pocket costs. While Medicare payment changes often focus on provider reimbursement, these changes can indirectly lead to higher costs for seniors. For example, if a service is no longer fully covered or if providers shift costs to patients, seniors may pay more for the same care they previously received at lower cost. Fixed incomes do not easily absorb these increases. It is also important to separate confirmed policy changes from political messaging. Headlines and social media posts often exaggerate or oversimplify Medicare news. Some claims suggest that Medicare benefits are being eliminated or that seniors will lose coverage entirely. These claims are not accurate. Medicare remains a core federal program, and seniors who are enrolled will continue to receive coverage. However, the details of how that coverage works can change, and those details matter. Medicare payment changes also interact with other senior benefits, including Social Security, SSI, SSDI, and pension income. Healthcare costs are one of the largest expenses for seniors. When Medicare coverage shifts, seniors may rely more heavily on Social Security income to cover medical bills. This makes understanding Medicare changes even more important for financial planning and long-term stability. Some seniors have also heard talk about stimulus payments being connected to Medicare or healthcare costs. It is important to clarify that stimulus payments are separate from Medicare. Stimulus checks are direct payments intended to support income during economic disruptions. Medicare payment changes affect healthcare services, not direct cash benefits. Confusion between these programs can cause unnecessary anxiety. The discussion around Medicare payment changes has continued beyond Trump's presidency. Some policies introduced during that time remain in place, others have been modified, and new proposals continue to emerge. What matters most for seniors is understanding which changes are already affecting them and which are still under discussion. Seniors should know that Medicare payment changes do not happen in isolation. They are influenced by economic conditions, healthcare costs, political priorities, and demographic trends. As the population ages and healthcare demand increases, pressure on Medicare funding grows. Policymakers respond to this pressure in different ways, including payment reforms. At the individual level, the most important thing seniors can do is stay informed and proactive, understanding how Medicare works, reviewing coverage options carefully, and planning for potential cost changes can help reduce stress and protect financial security. While no one can control policy decisions, knowledge gives seniors the ability to adapt and make informed choices. It is important to slow things down and carefully explain what Medicare payment changes actually look like in real life for seniors, because many people hear the word payment and immediately think of checks stopping or benefits disappearing. That is not how Medicare usually changes. Medicare payment changes usually affect how much doctors, hospitals, clinics, and other healthcare providers are paid for the care they give to seniors. When those payments change, the effects can gradually reach seniors through access to care, costs, and coverage rules. One confirmed area where Medicare payment changes have already taken effect involves hospital and outpatient reimbursement rates. These are the amounts Medicare pays when a senior visits a hospital, has surgery, receives diagnostic tests, or uses outpatient services. During the Trump administration and continuing afterward, Medicare introduced lower annual increases for these payments compared to previous years. The intention was to control federal spending and reduce what the government pays overall. For seniors, this does not mean hospitals close overnight, but it can mean hospitals become more careful about which services they offer and how many Medicare patients they can handle at one time. Some seniors may notice longer wait times for appointments or more limited appointment availability. This is not because Medicare has stopped covering care, but because providers must manage their resources carefully when payments grow more slowly. Smaller clinics and rural hospitals feel this pressure more strongly, which can affect seniors who already have limited healthcare options nearby. Another important area involves Medicare Advantage plans. These plans are offered by private insurance companies but paid for by Medicare. Under Trump-era policies, payments to Medicare Advantage providers increased, and rules were adjusted to encourage more seniors to enroll. Many seniors were attracted by extra benefits such as vision, hearing, and dental coverage. However, these plans also use networks, prior authorizations, and coverage rules that differ from original Medicare. Payment changes tied to Medicare Advantage mean that insurers receive set amounts per enrollee. When costs rise faster than expected, insurers may tighten approval rules or limit certain services. Seniors enrolled in these plans sometimes feel these changes when services require more paperwork or approval before being covered. While the plan still exists, the experience of using it can feel more restrictive. Prescription drug costs are another major area affected by Medicare payment policy. Medicare Part D covers prescription drugs, but it relies heavily on negotiations between insurers, pharmacies, and drug manufacturers. During Trump's presidency, several payment proposals were introduced to reduce what Medicare pays for certain high-cost medications. Some of these changes were delayed or modified, but the overall direction was toward controlling drug spending. For seniors, this can result in changes to drug formularies, which are the lists of medications covered by a plan. A medication that was affordable one year may move to a higher cost category the next year. Even when Medicare still covers the drug, the out-of-pocket cost can increase. This is one of the most common ways seniors feel Medicare payment changes directly in their monthly budgets. Another confirmed effect of Medicare payment adjustments is related to preventive and supplemental services. Medicare prioritizes essential care, but when payment pressures increase, optional or supplemental services can become more limited. Seniors may notice changes in coverage for physical therapy sessions, home health visits, or certain screenings. Coverage usually remains, but limits may be enforced more strictly. It is also important to explain how Medicare payment changes interact with Social Security income. Medicare Part B premiums are typically deducted directly from Social Security checks. When Medicare costs rise, premiums can increase, which reduces the net amount seniors receive each month. Even small premium increases can feel significant when living on a fixed income. Some seniors have noticed that their Social Security checks feel smaller even when benefit amounts stay the same. This is often due to rising Medicare premiums rather than changes to Social Security itself. Medicare payment policies influence these premiums indirectly by affecting overall program costs. Discussions about stimulus payments have added confusion to this situation. Stimulus payments were emergency financial support measures, not ongoing benefits tied to Medicare. Medicare payment changes do not create stimulus checks, and stimulus checks do not replace Medicare benefits. Seniors should treat these as completely separate programs with different purposes. Pension income also plays a role in how Medicare payment changes are felt. Seniors with pensions may have slightly more flexibility in handling rising healthcare costs, but pensions are often fixed and do not adjust quickly to rising expenses. When Medicare payment changes lead to higher out-of-pocket costs, pension income may not stretch as far as it once did. Another important aspect involves provider participation in Medicare. Some doctors choose whether or not to accept Medicare patients based on payment levels. When payments become less favorable, some providers limit Medicare participation. Seniors may find that a doctor they used for years no longer accepts Medicare or requires additional fees. This does not happen everywhere, but it has increased in certain areas. Medicare payment changes can also affect how quickly services are approved or processed. Providers under financial pressure may delay non-urgent procedures or require additional documentation. Seniors may feel frustrated by these delays, especially when dealing with chronic conditions that require ongoing care. It is also important to address fear-based claims that Medicare is being eliminated or privatized entirely. Medicare continues to operate as a federal program. Payment changes do not mean the end of Medicare. They mean adjustments to how money flows within the system. While these adjustments can be inconvenient or costly, they are not the same as losing coverage. For seniors, awareness is key. Reviewing Medicare statements carefully, understanding coverage rules, and paying attention to annual plan changes can help avoid surprises. Many seniors overlook mailed notices or assume nothing has changed, only to discover new costs later.